You're listening to the Fertility Docs Uncensored podcast, featuring insight on all things fertility from some of the top-rated doctors around America. Whether you're struggling to conceive or just planning for your future family, we're here to guide you every step of the way.
This podcast is sponsored by Receptiva Diagnostics. Receptiva Diagnostics is a powerful test used to help detect inflammatory conditions on the uterine lining, most commonly associated with endometriosis, and may be the cause of failed implantation or recurrent pregnancy loss. Take advantage by learning more about this condition at receptivadx.com and how you can get tested and treated, providing a new pathway to achieving a successful pregnancy. Receptiva Diagnostics, because the journey is worth it.
Hello, everyone, and welcome to another episode of Fertility Docs Uncensored. I am Dr. Carrie Bedient, one of your co-hosts from the Fertility Center of Las Vegas. I am joined by my jazzy, jeweled, and jovial co-host, Dr. Abby Eblen from Nashville Fertility Center.
Hey, everybody.
And Dr. Susan Hudson from Texas Fertility Center.
Hello, jazz hands.
Jazz hands, I like it. And we are joined today by Dr. Kristin Brogaard, and you're the CSO and the co-founder of Path Fertility and the originator of SpermQT. We are very excited to have you here today, both for your scientific knowledge and that we just love being around you.
Yes, I love being around you too.
So you were telling us stories about what you like to do when you have a few minutes to read, and Tell us the current hot genre in your house.
Well, I needed a little escape from being a full-time company owner, so I've gotten into the romantic fantasy genre lately.
That genre has exploded, and it's like it was a sleeper thing, and then boom.
So what do you guys mean by that? Because I like historical fiction. I don't do the romance kind of thing. So why is that expanded, or why is it exploded?
Let me tell you, historical fiction, I love that type of stuff, and the romantic fantasy is a step away from it because it still puts you in that other world, and you have so many really good series out there.
Yes,
is
exactly.
Like Court of Thorn and Roses. And
yes.
I've seen that book over and over again, and I haven't.
I have that book holding up my computer.
There you go.
Right now. That was one
yes. That's the book she's talking about.
It's literary crack, okay?
Yeah, it is. You get sucked into a world of dragons and fairies and magic and love and lust, and it's just, you can't put it down. It's very fun. It's a whole other world.
Wow.
That's on my recommended list. I have a running note in my phone of books to read. And so whenever I get a few minutes to go to the library or request stuff from the library, that's on my list. It hasn't quite hit the top. Like, I haven't been in a mood to read that particular stuff, but there's nothing that will make you feel fancier and more catered to than putting in a request at your library, walking in, picking up the stuff with your name on it that's labeled, and just walking out. I feel so fancy when I do that. Also, I may be a bit of a plebeian here.
I'm a huge audiobook fan because I'm driving all the time.
Me too, yeah.
And I have to say, I've tried a few dramatized versions of books before, and I've never been a fan. However, shout out to the Fourth Wing series. It's unbelievable. You have to listen to the dramatized version. You end up paying twice as much because they split the books up into, each book is 2 audiobooks.
Wow.
I was listening to them before the 4th book came out. And so when they published the audiobook, they published the normal audiobook first. So I bought it because I was so excited. I listened to it for 45 minutes and I was like, I can't do it. I need the voices. And I literally waited an extra 3 months for the dramatized version to come out. Actively listening to it right now.
Wow.
It is amazing. So if you are an audiobook fan, Fourth Wing dramatized version, worth every penny.
That's actually the book I was reading this morning. I took a half an hour break and I'm reading the first of the Fourth Wing, but I kind of want to jump into the audiobook book. That sounds awesome.
It's amazing.
Very cool.
Exciting news from Fertility Docs Uncensored. Our long-awaited book, The IVF Blueprint, is now available. Go now to pre-order your copy to learn everything you need to know about IVF, egg freezing, and embryo transfer. Did you know that you can cram decades of experience, science, and heartfelt advice into a book, and then the whole thing hinges on what happens in week 1? Yep, Week 1 is basically the prom queen election of publishing. So if you've ever thought, I should check out the IVF Blueprint by the Fertility Docs Uncensored crew, now is your moment to shine. Buying it early tells bookstores, hey, stock this. It tells publishers, people care about this. And most importantly, it helps get real information into the hands of people staring down fertility treatments with more questions than answers. The book's called The IVF Blueprint. It's for folks considering IVF, already in the thick of it, or just trying to figure out what the heck their doctor is talking about. Help us help more people, and maybe confuse a few algorithms while you're at it.
Okay, so audiobooks, love, romance, and lust aside, do we have any questions today?
We do have a question today. All right. It is, hi, I'm so glad I found your podcast. After nearly a decade, I'm still learning new things all the time. You always say the most embarrassing, the better. So I'm hoping you'll have the resources to be able to answer my questions. How many times a month should a man be ejaculating? My husband had a tessie and then a reversal. There was a blockage on both sides. While his semen analyses didn't really show much afterwards, I wonder if the results were not accurate as he goes long periods of time, including leading up to his semen analyses, without ejaculating. He has a low sex drive and we only have sex a handful of times a month at that. He doesn't masturbate. I'm not fully convinced his reversal wasn't successful.
Okay. Kristin, do you have any opinions on the frequency of ejaculation based on all of your time spent with, I'm going to say sperm, but that sounds much worse than it is. This is the beauty of having the guests that we get. So based on all your time spent with sperm, do you have an opinion on ejaculation intervals?
So the best data I've seen on ejaculation intervals is with DNA fragmentation. So we know that men have increased damage to their sperm DNA the longer it waits before being ejaculated. So there is relatively very promising and convincing data showing that very frequent ejaculation, either before an IVF cycle or before, probably mostly before IVF, because you don't need as many sperm, actually improves the quality of the sperm and decreases the DNA fragmentation rate. So
when you're saying frequent, that can be interpreted lots of different ways.
Great point. So for having an effect on DNA fragmentation, it's either daily or there are some papers out there where there's only hours between.
Wow.
In order to improve the DNA fragmentation quality. So that is really the only piece of evidence I know of.
Kristin, do you know, does that extrapolate to pregnancies? Have people looked at pregnancies or fertilization or just DNA fragmentation?
Yes. So the DNA fragmentation is primarily linked to a recurrent pregnancy loss. So they're seeing a decrease in DNA fragmentation and they have seen a decrease in recurrent pregnancy loss in those cases. But I don't think it is associated with fertilization and embryo quality.
Sperm don't just disappear. And so if you're concerned that he has a low sperm count because he's not masturbating, I would say that should not be a worry. Sometimes we'll have guys who have had an ejaculation and come in a very small interval and they'll have lower counts, but maybe better quality. But if we're looking to see if either a vasectomy reversal or some other physiologic blockage has been reversed and he has a low number of ejaculatory sessions, I don't think that that's really probably a contributing factor when it comes to low sperm numbers. Maybe if you have motility issues, sure. Okay, so if you have lots of them but only a small percentage are motile, then I could have some belief in that. What do y'all think?
Yeah, I would agree with that.
I think that's a great point. Yeah, your counts are going to decrease with longer time. They might not be living or motile, but they would.
Yeah. Excellent. Go sperm. Kristin, I get so excited whenever you email me because you oftentimes email me with data and that just warms the cockles of my heart. And so you guys are you in the process of, or have you completed all of your data collection?
In the process of.
We
are partially because we are collecting until birth. And so our primary endpoint of our clinical trial is pregnancy, but we have secondary endpoints where we want to track all the way to delivery. So
That's a
That would be
lot.
great. That would be really useful information. Yeah.
That's so for all of our listeners, that is a very painful lift because it means from the time you stop collecting data, you have to wait at least 9 months to get the data. And then you have to ask parents who have just had a newborn child that they have generally worked pretty freaking hard to get, and you have to get them to respond to you. And so that is a massive lift. It's super sexy data to have, like so hot, but it is a huge lift. So tell us who you're looking at and what you're looking for.
Absolutely. So this is a blinded, prospective, observational clinical trial. So there's a lot of words describing what we're looking for. The goal is, does our test, which we have shown previously in other studies to predict IUI outcomes, does it still predict IUI outcomes in a very controlled fashion, meaning there's a limited influence of confounding factors? We're really just blinded and tracking outcomes. So it's a really, yes.
The test you're referring to is SpermQT.
Yes, thank you for saying that. So SpermQT is now commercially available and is predictive of IUI outcomes. But at Path Fertility, our company, we're very, very data focused. And if we want to get SpermQT into the ASRM, which are the industry standard guidelines for male fertility, we really have to keep building up our data sets to show that we are predictive. So what we did in collaboration with a large fertility network called US Fertility is we designed a clinical trial to test men coming in that are eligible, and the couples are eligible for IUI. We took a semen sample and we tested it. So we got our SpermQT result, but we didn't share that result with the patient or the physician. So it's blinded. Yes, Carrie.
So when you say the people who are eligible for IUI, what was the cutoff that was used there to say, okay, if you have a sperm count or a total motile count above this point, we consider you eligible? What number did you guys use?
Yeah, so that was at the discretion of the physician. They could not be azospermic for sure.
No sperm, zero sperm.
In most cases, all men are above 5 million per mil, which is the cutoff for IUI. But I would say, looking at our data, we have very, very few men that are below the 15 million per mil cutoff.
Is it 15 million per mil or is it 15 million total motile count?
We had when I was looking at the current data, there's very few below the 15 million per mil concentration. And also for total motile count, we see very few below 20 million total.
Wow.
So these men
really
are
generous.
Normal semen numbers.
Huh.
That's very good. That means they're very applicable numbers to a lot of people.
Exactly. And the average total motile count for our guys was about 120 million. So they were relatively high. And and then the other factors is the females were younger than 38. The men were younger than 45. There was a BMI of 40 or under. And the women had to be ovulatory with support, or ovulatory and have one open tube at least. So really candidates for IUI. But it was really up to the physician's discretion at that point if they consider them eligible. And so we got a SpermQT results for these patients, but we didn't tell anybody what they were. So blinded is the key word there.
Starting a family is one of life's greatest adventures, and Fertility Centers of Illinois is here to make it happen. With advanced fertility treatments, IVF refund options, and flexible payment plans, FCI makes care more accessible across Chicagoland. Summer's the perfect time to explore your options and make the most of your 2025 insurance benefits. Visit fcionline.com to schedule your consultation, because your miracle is FCI's mission.
Yes, Abby.
In our book, IVF Blueprint, we love SpermQ. We talk a lot about it, but could you just, for our listeners that don't know what SpermQT is, could you kind of go through that real quick so they understand what the test actually is and what it looks at?
Absolutely. So we receive a sample in our laboratories. In this study, we received it right at the beginning of their journey. We isolate the sperm from the semen. We open up the head of the sperm, and then we sequence the epigenetics, specifically the DNA methylation across 1,233 genes. And we know those genes are critical for sperm to function properly. So they are things like capacitation, chromosome reaction, cell signaling, things that are very, very essential for a sperm to find, bind, penetrate, and fertilize an egg. And what we have found in our previous work over the last 6 years is that if men deviate from the right genes being turned on and off, we know which ones those are based on fertile controls, we can actually predict if they were going to be successful with IUI. So really, when you put in IUI, you're just recreating natural pregnancy by doing it at the right time and putting things in the right spot. So, but in that case, the sperm still need to function properly. And we're seeing that men who don't have those right genes turned on and off, the likelihood of IUI success is really low.
Like, how low are we talking about?
In our newest data, when we look at that first cycle of IUI and we look at all pregnancies, so spontaneous, timed intercourse cycles and IUI, so any pregnancy that happened before the procedure, while we were prepping for the procedure, IUI or timed intercourse, the men with an abnormal result have a 3.4% chance of achieving pregnancy. And this is controlling as much as we can for female factors. The men with the normal result, including spontaneous pregnancies, it's 19.1%.
Wow, that's a huge difference.
Huge difference. That's 5.8% fold change. It's pretty consistent now. When we were looking at our previous data, we're seeing that type of difference. And so in this clinical trial, we're seeing it again where we are testing it, but they're not providing feedback to physicians. We're tracking outcomes and we're seeing the same exact phenomenon, that SpermQT is predictive of outcomes, and not only just IUI, but it's predictive of timed intercourse and spontaneous pregnancy.
So the question I get all the time, and the question that I always have is, have you looked at guys yet, or is this in the works, that change lifestyle? Because you'd mentioned at one point that you think lifestyle change can make a difference. Have you done that? Are you seeing that? Or is that something to be done in the future?
Yeah, so we know, before we even started with SpermQT, we know that lifestyle modifications change sperm DNA methylation. What we didn't know was, does it change SpermQT specifically? And what we've seen now anecdotally, and I would love, Carrie, for you to mention what you've seen in your patient, but we've seen anecdotally now in lots of men with an abnormal result, their physician gives recommendations for lifestyle modifications, pretty standard ones that I think you three probably give often, reduce marijuana use, smoking, BMI, exercise, alcohol. Yes, alcohol is a big one. And then retest. And we've seen now so many times that it's gone from an abnormal to a normal. So I see the future of SpermQT really focusing on specific lifestyle modifications.
So with that being said, I know a lot of times we'll all have people come into our clinics and the women are like, my partner doesn't need to be tested. He already has 3 kids. We know he's not the problem. What are your comments regarding that?
Sperm DNA methylation changes with every spermatogenesis cycle. So you could have had 3 kids 2 years ago. That does not indicate the health of your sperm right now. Even human parameters, not just sperm epigenetics, they change drastically with what you're exposed to. Is he on testosterone? Is he drinking too much? Is he stressed? It's not an indicator. It's helpful. It's really helpful piece of information that he probably could get back to a healthy state, but that doesn't mean he's healthy now.
What do you recommend for, sometimes we have guys come in and they've got lots of things they can obviously work on. Okay. And those honestly are the easy ones to have the conversation, because it's okay, don't drink, lose weight, get your diabetes and high blood pressure under control, all those types of things. Stop your marijuana. Yes. But the challenge we also have are people who don't have any reversible factors. So either they're a normal age, and what I'm meaning by that is under 40.
Young reproductive age, yeah.
They're young reproductive age, and there's nothing identifiable I can change, or they're just older. It's not unusual to have gentlemen come in who are in their sometimes 50s and on up, and they're going to more often in my experience, have an abnormal SpermQT. Is there any data to support any other interventions, supplements, anything else we can do if there's not an obvious lifestyle factor that they can address?
Yeah, that is such a great question. And some people don't even have the luxury of time to address anything quickly. So I'll answer that in 2 ways. One, an intervention that works is IVF with ICSI. So it's a procedure that works if there's an abnormal SpermQT, which is standard of care for a male factor. So when there's a male factor going on, IVF with ICSI is the standard of care. So if a couple doesn't have the luxury of time or really can't figure out anything else to change, they've optimized their health, there's an option, a procedural option that could really get them to a pregnancy more quickly. I am really interested in therapeutic interventions for men that might improve their epigenetics that's beyond lifestyle. So looking at anastrozole, Clomid, any high potent antioxidant use.
Mm-hmm.
We've seen some DNA methylation changes with antioxidant use, so that could be an interesting addition. But we don't have the data yet to pinpoint exactly what to do and when. So I wouldn't be able to recommend anything because we just need more and more data for that. There's also some men probably because of genetics have abnormal epigenetics. So there are some men who probably can't change that part of them. So I think that's an important point as well.
One thing too, I wonder about, because that was a great question, because I have at least 2 guys. In fact, the very first guy that did this test, when it came back abnormal, he was 25, young, healthy, in the medical field, and they went on to do IVF and were successful. But ultimately, I had that same question, like, well, he doesn't have any lifestyle issues. But I start to think about in women, see that the athlete's triad, stress, low-fat diet, heavy exercise. And I wonder if that impacts men in the way it does women. You know, the body's trying to conserve energy. Maybe it's like flipping off the genes to help him father a child. I wonder, is that something you guys have looked at all?
We haven't, but there are data out there showing that exact thing, that stress, sleep, all of that stuff that we know impacts our somatic health is impacting sperm health. So there might not be something obvious like a BMI number or smoking, but just excessive exercise increases inflammation, increases DNA damage in sperm. So there's a lot of things that are really impacting sperm quality that might not be kind of the top big ones that you see in the clinic.
So the patient that Kristin was referring to was the one that sold me on SpermQT that we were all super excited about. Is I had a couple where they came in, she was under 35, he had known sperm issues, had a low count. IVF was always the only option. The counts were never high enough to do anything else. And we did an IVF cycle and didn't get anywhere with it. We got embryos, but had a miscarriage, transferred all of them, didn't work, did another IVF cycle, same thing, didn't work, miscarriages or negatives. And then they said, okay, we're really going to clean everything up. And so he stopped drinking, he stopped smoking, he stopped doing any other substances. He started supplementing with vitamin D, Fertile Aid, vitamin D, vitamin C, omegas, B complex, like arginine, all of this set of supplementation. And then we did the frequent ejaculation protocol with him, got more embryos that were euploid, so correct number of chromosomes than we had ever had. First transfer, baby. She was already 38 by this point, by the time they came back and they were ready to try. And so we had repeated the SpermQT. We did it initially as soon as it came out, which was after they had already done their first 2 cycles. The initial result was an abnormal result. And then he made all these changes. We retested because we were just curious. The QT came back normal at that point after he had really made those changes. And then that's when they went on to do IVF and got really amazing results.
Carrie, I'm curious, in that patient, did you do DNA fragmentation testing while you were doing those other things? Because a lot of those interventions, I think, are pretty tightly correlated with DNA fragmentation. Not that you couldn't fix DNA fragmentation and also fix the abnormal DNA methylation and turning on and off of the genes. I'm just curious.
I think we did. I don't remember that off the top of my head. I know we did at some point. But honestly, I don't know that I remember that. Now
if his count was really low, you may not have had enough to do DNA fragmentation.
Yeah.
If you had enough to do SpermQT, usually you
that's true. Yeah.
DNA methylation. So for our listeners, generally, how much sperm do we need to be able to get the test run?
Yeah, we have a 1 million sperm total cutoff. But we do see more failures if you're really, really low. But if you're severely oligospermic, meaning you have really low sperm counts, you already know that there's a male factor, and you might not, SpermQT might not be the right choice. But we've gotten away with about 1 million cells.
But it can be a helpful thing in helping figure out, especially now that the pendulum is swinging between ICSI back over to standard insemination.
Yes.
These people with the abnormal SpermQT, they generally are going to need the ICSI, where we inject the best looking sperm into each egg, because what these genes don't know how to do is actually get in. So my understanding is once they get in, they know how to do their job. that can also play a factor in it. So if you're really trying to minimize your ICSI and you're having results you're not expecting and not as good a fertilization, this might be a solution.
Yeah, that's exactly right.
So Kristin, what's on the horizon? What have you got out there planned for SpermQT testing that we may be interested in going forward?
I'm so excited for the future. I love that question. So I feel like with sperm epigenetics in general, we are just scratching the surface.
Yeah.
This is this is where the data led us, IUI prediction. I think with our clinical trial and sitting on a lot of new epigenetic data, we could, one, improve our current test to be even more predictive and maybe even subset individuals into different classifications of infertility rather than bucketing them all together, which we're doing right now. I also know that we're with our clinical trial and the other data we now have split cycles, meaning standard insemination and ICSI. We have miscarriage rates. We have embryo quality data. We have fertilization rates. So what I can't wait to do is once we get to a really good of these patients with outcomes is do additional discovery and identify, can we be predictive of multiple steps throughout the fertility journey? Not just IUI outcomes, which is really important, and you need to know that early on, but can we predict implantation success?
Oh, yeah.
And embryo quality? And there's things you can do to optimize each one of those steps. And if you had that knowledge, I think it would be really powerful. So I'm very excited about what's to come with SpermQT because I'm imagining it to be a much broader, more comprehensive test in the future as we get more and more data.
I was curious, at what point in sperm formation, so it takes on average 72 days to make new sperm, is the methylation process that essentially turns these genes on or off, is that something that can happen anytime in those 72 days? Meaning maybe we know we're going to go forward doing something and I don't have a full 2.5 months to make an impact, but would I have at least some impact if I made a lifestyle change or made some sort of modification to improve parameters?
Yeah, great question. So sperm as a population, there's all different, when you look at sperm, they're all unique in their own way and they have their own epigenetics associated with them. As you make lifestyle modifications, during out the spermatogenesis cycle, you can be modifying those new ones being developed and shifting the population of sperm. That 3 months is when you can get a whole new set. So you get all the bad guys out, but you can absolutely be shifting the population of sperm. What's really interesting about sperm and makes it a fantastic substrate or specimen to analyze is once they are mature, there's no changes in methylation. There's no gene expression. They are static little creatures. So all those changes that are happening are in the testicle during spermatogenesis at all the cycles, meiotic and mitotic, all the way getting to that mature sperm. But once it's matured, the DNA condenses down, is super tight, and it's not active anymore. So you have to hope that all the right things were made, all the right proteins are on the membrane, all the right RNAs are in the head once that is mature. So you can shift your population and then it's not active when it's mature.
So I have an adjacent question to all of this is, how did a nice girl like you end up in a field of study like this?
Okay, so in reality, I have the sense of humor of like a 13-year-old boy, and I think it's so funny to talk about sperm and sex. I fit in really well, and my friends think it's so funny because it just kind of fits my little silly personality well. Also, I did my first startup out of my postdoctoral work, and I got the bug for starting companies. I love creating something from nothing and actually developing a solution for an important need. And when this problem in the field was presented to me by my current co-founder, we weren't co-founders then, I fell in love with it. I thought the biology was cool. The mission hit home that all this burden's on the female partner and the guy is just ejaculating into a cup and that's all we're doing, like testing is counting the sperm.
Yeah, that's right.
So, and then it kind of fit with my like silly personality of laughing at sex jokes and stuff.
Okay, so a follow-up question to that. When you go to a cocktail party and somebody walks up to you and starts talking to you and they ask, well, what do you do, Kristin? What's your reply to that? Give me the funny response and the serious response.
I don't give a funny response, but I wish I should work with you guys to get like.
You need a funny response.
Yeah.
Yeah. It's just, it's focusing
I have my hands in sperm all day or something like that.
I'm elbow deep in
by his
sperm or
ejaculate.
something like that.
Yeah, I'd know a lot more about you if I knew what your ejaculate looked like.
I should bring cups with me to a
that'd be
cocktail
great.
party.
Here's what I do all day.
Branded cups with you.
Yeah.
Like
SpermQT cups.
QT with pictures.
That is a really great idea. No,
Yes, since you're entrepreneurial, you ought to come up with some cups with your branding on them.
I love that. Like my business card is a
Drinking cups with your branded stuff on them.
I love that.
No, ew.
No, Abby, you took it too far.
Oh, I'm sorry. If I bring Carrie out,
giant hole
we're
here.
in trouble.
Normally Abby is the good one out of all of us. So I'm impressed, Abby. Good work.
You're making me like blush. That's really funny.
Yeah, usually I don't do that.
One that has the humor of a 13-year-old boy blush.
Yes.
Good work.
Good job.
You should do semen analysis collection vials that are branded that have, instead of the base being flat like a normal collection cup, that have kind of that taper like the end of a test tube so that everything concentrates down.
Yes.
So that you don't miss a single drop of
single drop. You get all of them. I love that. That's a great idea. We should have our own. Get every last drop.
Patent tip.
One of the
put me on the list.
Well, as a gift for, people that you like or maybe people that you don't like, at ASRM one year they had like mouse pads that had, and you've probably seen them, they have a little sperm, and when you move the mouse pad, it has some liquid in it. It looks like the sperm.
I have seen that. That's
So
really cool.
So back to my cup again. Sorry to gross you out, but that'd be really cool if you had a cup with like little sperm that were swimming around. Maybe not a drinking cup. I don't know. Maybe a planter for your vegetables or something. But
I love it. All right.
All right.
Jotting these down.
Carrie's thinking.
Yeah, Carrie has some great idea right now.
Yeah, this
You might want to internalize this one.
This will occupy me for the rest of the day.
Well, anything we didn't cover, any other exciting news we need to know about SpermQT and all the active work you guys are doing?
We have really cool projects in the pipeline as well in other areas of male fertility, especially when there's no sperm. We actually are working on an ability to predict if there's sperm in the testicle using DNA methylation from cell-free DNA in the semen. And working really hard. We have a clinical trial going right now. So the goal there is men who don't have any sperm, they usually have to get a testicular extraction, which is a very, very invasive and expensive procedure.
Yeah.
It has a 50% likelihood of success. So this will predict that in order to give better expectation and prediction to decide if you want to go through a very, very invasive procedure and likelihood of achieving a successful sperm extraction.
How close are we to being able to have that test available to us?
I'm thinking end of this year.
Wow, no kidding. I bet the urologists are very excited. I bet they can't wait.
Yeah, the data is pretty exceptional. So we're very excited about it.
So tell our listeners how they can access this test. Yes. And of course, one easy way that I know how to tell them is if your doctor automatically orders it, that's super easy. But if they have a doc who doesn't necessarily know about it, how do they get there?
Yeah, absolutely. So you could ask your doctor for it, and it's growing. So people hopefully know how to do it. If they do not, you actually can order the test directly from our website, which is PATH fertility.com. And we have a physician on the back end that will be there to review results with you and make that order for you. So you can have a consultation depending if you want to with the results. And we have a discount code for all our FDU listeners. So it's just FDU discount. You put it in, you get a discount on SpermQT. So you just go to Path Fertility, pathfertility.com. And what I would recommend to the viewers when they're listening, it's really important to get a comprehensive assessment of the male partner as early as possible, semen analysis, SpermQT, and just start talking about that because that really can change the trajectory of your fertility treatment if there's a male factor. So the earlier the better when you feel like you're struggling to get pregnant.
All right. And tell us the discount code one more time.
It's the letters FDU, which stands for Fertility Docs Uncensored, my favorite podcast.
Yeah.
That's awesome. Well, thank you so much for coming to play with us, Kristin. We always love having you and your sense of humor around with us. Whenever we're at conferences, we always find ourselves hanging out together, which is delightful. So thank you so much for coming to play with us.
Thanks for the opportunity. This is always a pleasure.
And to our audience, thank you so much for listening. Subscribe to Apple Podcasts to have next Tuesday's episode pop up for you. Subscribe to YouTube. That really helps us spread reliable information and help as many people as possible.
You can also visit us on fertilitydocsundcensors.com to submit specific questions you have and sign up for our email list. And don't forget our upcoming book, The IVF Blueprint, coming out in September.
As always, this podcast is intended for entertainment and is not a substitute for medical advice from your own physician. Subscribe, sign up for emails, and we'll talk to you soon. Bye.
Bye.
This podcast is sponsored by Receptiva Diagnostics. Receptiva Diagnostics is a powerful test that can help detect inflammatory conditions on the uterine lining that might be preventing you from becoming pregnant or staying pregnant. If you have experienced implantation failure or recurrent pregnancy loss, ask your doctor about Receptiva Diagnostics testing. If found, uterine inflammation can be treated, providing a new pathway to achieving a successful pregnancy. Receptiva Diagnostics, because the journey is worth it.